We're talking to Fionnula McLiam, who is a clinical advisor with OCD Ireland, or Obsessive Compulsive Disorder Ireland. Fionnula, you're very welcome to Disability Matters.
Thank you.
So you might tell me first, what is OCD and how does it affect whoever suffers from it?
OCD, Obsessive Compulsive Disorder, is it's a disorder that affects approximately 1 in every 75 people. So it's actually quite common, even though people don't know a lot about it. And one of the reasons people don't know about it is because a lot of people who have it are very, very ashamed. The reason they're ashamed is that they get intrusive thoughts, disturbing and distressing intrusive thoughts in their head. And they can be generally they go against a person's value. They can be about sex or violence, religion, danger. And they feel that these thoughts reflect their true selves. Now, actually, they don't. They're actually the opposite of their true selves. And that's what makes the thought so distressing. But it then rules often how they behave and think about things. So that's OCD, basically.
Yeah, so it's a tough disorder to have.
It is indeed, yeah.
And I presume it affects your mental health also.
Well, yeah, because, I mean, if you keep on having these kind of horrible thoughts that go against your true self, you really start doubting yourself. And there's no way of really knowing. They cause a lot of anxiety. So, I mean, we all have intrusive thoughts, right? And for most of us, those intrusive thoughts are helpful. You're walking down the road and you're going, oh, it's Jenny's birthday tomorrow. I must remember to buy her a card. That's great, very helpful, as long as you do remember. But these ones are really, really horrible. As I said, they go against your true values. They can be things like people who check. They check switches, they check doors, they check windows, because they're terrified if they don't close the door and switch everything off, something terrible is going to happen. Sometimes to themselves and sometimes to their loved ones. So you can imagine that kind of, thought. You go out for the day and you're 50 miles away from home and you go, did I leave the immersion on?
Yeah.
Less and less nowadays.
Everybody does it.
Everybody does it. But if you had OCD, you'd be going, oh my God, the immersion's going to explode. It'll overheat. It'll explode. It's going to be a disaster. What if someone's in the house at the time? So you drive back, where most of us would go, nonsense. Probably didn't do it. I'll carry on with my day. But they're going back because the anxiety, the consequences could be so terrible.
Okay, is there a known cause? Is there
a
known cause?
No, nobody knows what the cause of it is. They've looked into everything. Is it genetic? It doesn't seem to run in families. Is it as a result of a viral infection? Nobody knows. What we do know is that it can start in childhood. So children can be quite obsessive in some ways. So, we used to have that thing as kids, don't step on a crack in the pavement or you'll break your mother's back. And they'll start off with that kind of small thing and take it seriously. If I step on the crack, something terrible will happen, my mother. Yeah. But most of us just grow out of it and get over it. But for a lot of people, it stays. Now, adolescence would be a high point, and late adolescence would be a high point for developing OCD. And because people don't come forward because they feel it's a personal failing of theirs, that they're having these horrible thoughts, it can take up to 17 years to be diagnosed, that they're struggling on their own with this, not realizing it's an actual disorder. They think it's themselves.
Wow, 17 years. That's a real wow number.
Yeah, yeah. But they're ashamed. I mean, if you're having thoughts of maybe raping someone or being raped, you don't know what it is. These thoughts seem normal and natural, but they're not. They're highly anxiety provoking. So the obsessions that people carry, these are the obsessions. The compulsive part of the disorder is you're trying to do something either to prevent them happening or to escape from this anxiety. So, if you have doubts about checking the house, you go and do another check, and then another, and then another. And next thing you know, it's taking you 2 hours to go to bed.
That's a tough life. Can I ask you, can OCD be prevalent in the one family, or is it sporadic?
As I said, it doesn't seem to have a genetic origin, but someone who is really obsessive can pass a lot of their anxiety on to their kids often.
Right.
I remember a case when I was working in London of a family who the mother insisted that they get changed in the entryway so that they wouldn't bring in any kind of germs from the outside. So the entire family had to strip out of their so-called dirty clothes and into clean clothes. So you can imagine if you grow up with that, you might be germophobic. You might not.
Yeah.
But it's not guaranteed that you're going to get OCD as well. So it can be just one member of a family who's doing it, but they can cause disruption for the rest of the family by their obsessions with things.
Now, I wanted to ask you about the difference between obsessions and compulsions, because I read a bit there that you can have either or both.
Yeah, because the thing is that obsessions are internal. This is what you're thinking about all the time. And some people's obsessions, they're thinking, overthinking and overthinking. Did I accidentally kiss someone who wasn't my boyfriend at the party last night? And so they go over, they review it mentally over and over and over again in an attempt to get clarity. They may ask their friends, did anything happen? And the friends go, sure, no, nothing happened. And then you get a doubt in your head. Maybe they weren't there at the time. Maybe they'd slipped out to the loo. So this is the kind of obsessing that people do. The compulsion is what you do to try and get rid of it. Because the obsession gives you high anxiety, is there any way of knowing for sure that you accidentally kissed someone who wasn't your boyfriend? They'll start thinking, I wonder, did the hotel have CCTV? Could I get the CCTV?
Oh, man.
Yeah. Can I ask all my friends whether they saw anything? So then they ask the friends, and then the friends go, no, and they go, sure, that's what she would say anyway. And this is one of the reasons why it was originally called the doubting disease, is you start off with something and you keep doubting and doubting and doubting. You're looking for reassurance. And some people do mental reassurances or neutralizing activities in their head, like maybe saying prayers or repeating a phrase to try and get rid of it. And that doesn't always work either. Right. So those are that's a kind of mental way of trying to reduce your obsession.
And tell me this, do we know the stats behind it? Do we know how many people suffer from OCD or have OCD? And do we know the gender split?
It's evenly split between the genders. Okay. I don't think there's anything saying that one sex gets it more than the other. The amount of people is generally reckoned to be between 1% and 2% of the population.
Okay. Not only can you have OCD, but there's other disorders involved. Can you tell us about trichotillomania? Trichotillomania.
Yeah, trichotillomania. We usually shorten it to TTM for obvious reasons.
Yeah, for obvious reasons, yeah.
Yeah, it's hair pulling, basically.
Oh.
So it's the way women often will play with their hair, So it tends to start with something like that, and then they pull. So this can get quite extreme, so that people are left with bald patches. Now, for most men, the cure is simple. They just shave their heads. End of problem. Nothing to pluck. Women don't do that.
For obvious reasons.
Again, yes.
Yeah.
But what they can end up with is like bald patches on their head, because they might be plucking from one part, like the nape of their neck or the crown of their head, and they'll end up with a bald patch, and then they end up with some sort of elaborate hairstyle to try and cover this. Or they tell people they've got alopecia. And there's often there's two kinds of hair pulling in a disorder. And one is that you do it in a kind of a trance. You're not even aware you're doing it. You're watching TV, and next thing you know, you have a whole pile of hairs on the arm of your chair. Or you can actually be doing it deliberately. So you pluck each hair consciously, you feel along the length. You might want to have the little hair bulb at the end, and you can just feel that with your fingers. The problem is that people do it over and over again, because in some way it seems to relieve anxiety. But of course, if you're a woman going around with big patches of baldness on your head, you don't want people to know that. You don't want people to see it. Their hairdressers will know, and they'll help them with hairstyles to cover it up. But yeah, that's one of the things. The TTM, the trichotillomania, is part of a body of disorders called body-focused repetitive disorders, which covers things like nail biting, or biting the inside of your cheek, or anything that people do. Skin picking, again, would be another one that's quite common.
And tell me then, what about body dysmorphic disorder? What's that about?
Body dysmorphic disorder is a really awful disorder where you think there is something grotesque or horrible or ugly about your body. There was a case many years ago of some poor lad who had to be called. They had to call an ambulance for him in a nightclub in Spain, and the reason being that he'd collapsed. He'd collapsed because he believed his body was awfully skinny and ungainly. And so, to cover this up so people wouldn't notice, he started wearing bulky sweatshirts and covering his body with these big clothes. So you can imagine summer nightclub Spain. No wonder he collapsed of dehydration.
Absolutely.
Yeah. So, and it doesn't necessarily always refer to the whole body. Sometimes it's just a part of the body.
Yeah.
Like, my nose is enormous. My ears stick out. I've got terrible bags under my eyes. People have all these beliefs. And as you can imagine, if it's your face, you can't actually cover it up.
Yeah.
So they kind of try to shrink themselves so that it will not be noticed. Keep the head down, wear loads of makeup. Not so much for the men, but I've known men who wear makeup just to cover up what they think is awful skin. And, I can look at them and say, you actually look totally normal to me. They won't believe me, because they're absolutely sure what they can see in the mirror is what other people are seeing.
Yeah. Wow. And is there treatment for any of these three?
Yeah, I mean, the recommended treatment is generally CBT, which is cognitive behavioral therapy.
Okay.
And there's been a lot of work done on that. So there are CBT therapists around in Ireland, but the thing is, because therapy, as you know, hasn't been properly regulated so far, Corú is only just getting around to it. Anyone can call themselves a CBT therapist. So it's a matter of finding out, are they accredited with a professional body? And there are two of them. There's CBT Ireland, and there is BABCP, which is the British Association for Cognitive Behavioural Psychotherapy. And that the Irish branch covers both Northern Ireland and the Republic.
And tell me, does the treatment work?
It depends.
Yeah, I'd imagine, yeah.
The treatment is difficult. It's difficult for people. I mean, the major part of the treatment is getting people to realize that these are just thoughts. Horrible though they may be, they are still thoughts. So if you're standing on a crowded train platform and the thought pops into your head, oh, I could just push this person off the platform as the train's coming in. It's just a thought. You didn't do it. You find it so abhorrent, it makes you sick to think of it. There's no way you're going to do it. So it's really about motivation to get engaged in the treatment.
Yeah.
And then we do the treatment, and an awful lot of people come out much the better for it.
Oh, brilliant. Wow. Yeah. That's a tough life with all of those three. Tell me this then. What's the diagnosis like, and how long does it take?
Well, I think it's really obvious to a medical professional once the person opens up and talks about it. But as I said, shame is the major reason. You know, when you're convinced that your nose is absolutely grotesque and you think everyone else can see it, it seems a bit obvious to tell the doctor that.
Yeah. But that's a tough thing.
It is, yeah. You know, if you say you're self-conscious about your nose, they just generally brush it off, because all of us have been self-conscious at some stage or another.
Of course.
And you really have to insist on the gravity of this and how it's interfering with your life. I don't go out during daylight at all. I wear a hat with the brim pulled down, you know, this kind of thing. I cover up. I avoid looking at my reflection. I avoid windows that I might be reflected in, you know. Then the medical professional can understand what's going on better.
Right. So that must take time.
Yeah, because it takes time to acknowledge, as I said, people think it's just them. They don't know it's a disorder.
Of course.
If they have never heard of the disorder. But as I said, because people are ashamed of it, even though about 1 in every 75 people has it. When I say 1 to 2%, it sounds like a minimal amount, you know, it's 1 per 100 but you know, if you have, most of us have an acquaintanceship of around 2,000 people, you know, people you went to school with, worked with, and so on, your neighborhood, anything you were involved in. When you find out it's 1 in 75 people, if you know 75 people, you know someone with it.
Right.
They won't tell you.
That's a startling fact, I have to say.
Yeah.
Wow. Now, if we move on then to OCD Ireland, when was that founded?
I can't. Sometime in the 90s is all I can tell you.
Tough question.
Yeah. These things are sort of lost in the midst of time in a way.
Yeah.
We've been running support groups now since the early 2000s. And we were recently recognised as a charity. There's only really a small amount of people involved in the organisation itself, and we were all working full time as well, and had, you know, the usual families and everything else. So, yeah, we were a bit slow about getting to the charity bit. But yeah, we've been running these support groups now since about 20 years. And recently, with the help of some American OCD organizations, we were able to broaden our scope a bit. We had an OCD meeting in Dublin in person, where we went for a walk in Phoenix Park and went for cups of coffee afterwards in a local hotel. And it was absolutely brilliant. We had the people who were attending the groups, we had facilitators, we had the organizers. And it was really wonderful. it's so wonderful for people with OCD to get together with other people with OCD and realize, although the way it manifests itself is very individual, they're all going through the same thing and talking about how they cope and what they're getting on with and all that. I have to say, it was really heartening for me to see that.
I'd say that's a great comfort to support groups.
Oh yeah, absolutely. Absolutely. We have one for the sufferers of OCD. We have one for people with TTM, trichotillomania, the hair pulling I was talking about. We also have one for friends and family members of people with OCD, because life can be very hard living with an OCD person. Quite a few people with OCD with this kind of germophobia, contamination, fears, will take showers, not just once a day. It could be 5 times a day.
Wow.
It can be, half an hour each time. And it can be really, really hard for the families. You're barely able to get into the bathroom. The electricity bills are rocketing, all the usual stuff.
So tell me, what advice would you give to somebody who's just been diagnosed with OCD?
Well, I would say is read up about it. Have a look at the OCD Ireland websites. We've got lots of information about OCD there. And join a support group if at all possible. Now, some of them are in person and some of them are on video call, because we used to only have them in person until, I think, the pandemic, when we had to go to Zoom. But of course, we only had the in-person ones in Dublin, and it was just brilliant to be able to facilitate people from all around the country, that they weren't having to drive mad distances to get to Dublin for a support group. So we've continued the online ones as well.
Wow. I tell you, it's a great support. I went through your website. That's what I do. And if I had OCD, there's a fabulous amount of information out there. Now, Can I tell you, we're coming right to the end of our interview. You'd be glad to know. Is there anything else you'd like to say before we go?
No, I would just say, if you suspect you have OCD, if you have intrusive thoughts that are disturbing and distressing, go and see your GP. Tell them you might have OCD. They'll refer you to a psychiatrist. Now, I know there's waiting lists, but everyone takes the thing of waiting lists as being there's always going to be a 2-year wait, which is not the case. The waiting lists will vary from time to time, from county to county. And often you can access a CBT therapist free of charge within the HSE mental health services. Not everywhere, not all the time, unfortunately, but they are there. Help is available.
Good. And the other thing to say is, you're not the only one. There are loads of people out there.
Absolutely, yeah.
Right. Well, look, Fionnula, thank you so much for coming on. Thanks for telling us your story. I was very taken by all of the conditions. Wow. What a tough life for people. But
I know.
There is help. And that's the message. Thanks a million for talking to us at Disability Matters.
Thanks very much for asking me. Bye-bye, John.
Great to have you on.